guys so much for joining. My name is Jen Scheinman. I am the Senior Manager of Nutrition Affairs at Timeline. And I'm so incredibly honored to be up here chatting about women's longevity and some of the unique challenges that we face as we get older. And I'm joined by this incredible panel of experts that are really pioneering and changing the way that we think about health. So I'm going to actually allow them to introduce themselves and talk a little bit about the work that they're doing, and then we'll really dive into a juicy conversation. So why don't we start with you, Dr. Walls?
So I'm Terry Walls. I'm a clinical professor of medicine at the University of Iowa. I conduct clinical trials testing the effect of diet and lifestyle in the setting of multiple sclerosis. We're doing the largest dietary studies in the setting of MS with 162 people with MS, testing a ketogenic diet, paleo diet, usual diet, 2-year study including MRIs that will finish in the summer of 2026.
Thank you.
Hi, I'm Dr. Felice Gersh. So I am an integrative OBGYN. I'm dual board certified in obstetrics, gynecology, and integrative medicine. I'm on the faculty of the Fellowship in Integrative Medicine at the University of Arizona School of Medicine, and I have a practice in Southern California, in Irvine. And I treat women of all ages, but I do a lot of menopausal longevity care. And so I have an expertise in hormones as well as all the ancillary things that go into being healthy as you age. And I write books and I travel and I tour and educate because it's my mission to facilitate every woman to be able to optimize the quality of her life for as long as possible.
My name is Dr. Stephanie Estima. I'm a doctor of chiropractic. That's my original training. So I have an ongoing love affair with the neuromusculoskeletal system. And so my work is focused on lifestyle interventions for meals, how we can use our nutrition to upregulate health, how we can use exercise both in muscle development and muscle hypertrophy, as well as joint mobility and joint health, tendon health, ligamentous health, and then, of course, mindset, which is sort of the tenets. I like to call it meals, muscle, and mindset. I'm a podcast host. I've been honored to have both Dr. Walls and Dr. Gersh and Cynthia on my show, and I'm just thrilled to be here today with all of you.
My name is Cynthia Thurlow. I'm a nurse practitioner, and really the last 9 years I've been solely focused on women's health, perimenopause, menopause. Intermittent fasting is probably what I am best known, but I always like to remind people that is one of many strategies that we can use with our perimenopausal, menopausal females. I also have a podcast called Everyday Wellness. Have had the great honor and distinction of having all of these ladies on multiple times. And so I very humbly have kind of pivoted and really focusing in on the gut microbiome and what is changing there that impacts not just immune function, but bone health and metabolism.
Wonderful, thank you. So Dr. Gersh, let's start with you. You've spent your career as an OBGYN. What are some of the unique challenges that women are facing that might be different from our male counterparts as we start to age?
Well, it's really important to recognize the differences because women's bodies evolve in such a way to facilitate pregnancies. And pregnancy is the ultimate stress test of a woman's body. And in terms of heart function, for example, a woman's heart has to pump at least 50% more blood volume when she's pregnant. So the energetic needs of a female heart are really quite different than a male. And women's immune systems are quite different. That extra X chromosome has most of the immune genes on it. And we are programmed to have more white blood cells, more immune system robustness. So we have a lot of differences. And 100% of women go through menopause. And we lose that vital life hormone, estradiol. And estradiol is really a critical part of every aspect of health, including the production of energy. Mitochondria, which are the little organelles that control the cell cycle. It tells the cell when to die, when it's old and yucky, like a zombie cell. And it controls the production of energy. It controls what's called mitophagy, which is like mitochondrial renewal and when the mitochondria should die. And it manages an enzyme that's in mitochondria that helps to take superoxide, which is a metabolic byproduct of the production of energy, ATP, and convert it into hydrogen peroxide so that the hydrogen peroxide, which is not something that superoxide can do, can get out of the mitochondria into the cell where it can be converted into harmless water. So every woman is going to have a challenge in the production of energy in every organ system. One of the organs, and you'll talk about it, is the muscle mass. And they, of course, all the muscles need energy. So there's no organ that doesn't need energy. And women's bodies are particularly unique compared to men in needing estradiol. So we have to come up with ways, workarounds, because even though every woman goes through menopause, it's natural but not beneficial, that we have to separate those two. And even when you go on hormones, and I'm sure you've all learned so much about hormones, it's not the same as being 21. We can't give a pair of 21-year-old ovaries back. So we need to harness a bigger therapeutic toolbox so that we can optimize energy, the spark of life. If you don't have energy, you have no quality of life. And when you have zero energy, that's called flatlining, then you're not having life at all. So this is really unique in women, that they have this greater need for support of mitochondrial health.
So that's really an incredible thought to kind of like follow up with. So Dr. Walls, we know that women are more likely than men to develop things like autoimmune conditions. Is there a relationship there between energy production that Dr. Gersh was talking about, or can you spread some light on why that's happening?
Well, you have an autoimmune condition, and early on, there's a lot of inflammation. Symptoms come and go. Getting around age 40, you have aging of the immune cells. There's very few exacerbations, whether it's MS or other systemic autoimmune disease. In its place, you have this slow, relentless decline, and that's a decline in energy production. That is a decline in mitochondrial efficiency. That is accelerated aging of the immune cells. That is accelerated aging of the brain. That is accelerated aging of the bones, the muscles, and that is the phase in the setting of MS where you begin to have no more relapses, but there's relentless loss of function, worsening fatigue, worsening anxiety, worsening depression, worsening brain fog, and slow worsening of your hand function, slow worsening of your walking function. And between age 45 and 55, most of those individuals will no longer be employed, and most of those individuals will be needing a cane, walker, or wheelchair. In my case, that happened at age 48.
So one of the things I think that's most impactful when it comes to just the decline in energy that's happening and as we get older is some of the lifestyle tools that are available to us every day. So Dr. Stima, we were chatting a little bit yesterday about strength training, for example, and some of the unique ways that women should think about training, and especially women, I think, guilty in my generation, a little older, maybe shied away from strict training. Can you just shed a little bit of light on what that can do for women's muscle, brain, and also mitochondrial health?
Yeah, this is a great question. So just for all of you that are here, how many of you grew up in the cardio section of the gym? Yeah, right. So what we want to do now, and there's nothing wrong with cardio, right? We need cardio, to your point, as we lose estradiol. Estradiol, of course, is very important in helping that suppleness of the arteries vasoconstrict and vasodilate. So we do need to be working on our cardiovascular and cardiorespiratory fitness. However, a lot of women who grew up in the cardio section of the gym never really moved to the weight section of the gym, right? So I think that it's important for us to have cardiovascular goals, but we also want to be thinking about becoming what I like to call lovingly muscle mommies. So we also want to be moving to the muscle, like to the weight section of the gym. And to answer your question, when we are strength training, when we think about the neuromusculoskeletal system as a whole, every time that you are contracting your muscles, you are going to be engaging in cellular mitophagy, which is sort of this cleaning of mitochondria that are not operating in the optimal way that they should. You're also engaging in something called mitochondrial biogenesis, which is just medicalese for new mitochondria. So the more that you weight train, the more energy that you're going to have, the more direct effects you're going to notice in terms of your everyday energy. We can skip the aesthetics. Like, you know, we all know that big, beautiful, juicy muscles look great. But in terms of what it does for the human body, for the female human body, of course, it's going to give us a mobility advantage. And I think in perimenopause, we don't think too much about mobility. Like, we're all relatively mobile when we're 40 and we're 50. But it's when we sort of get to that 60, 70, 80-year-old mark where a fall can be absolutely catastrophic. And so I'll just throw out a couple of sobering stats for you. Last year, the CDC reported 300,000 hip fractures as a result of falls. 75% of those hospitalizations were female. 50% of the women who were hospitalized never made it out of the hospital. 50% died. All right, so these are very, very important things to consider as we are aging. Muscle and bone, the two together, give us this mobility advantage. The other thing that lifting weights does, it gives us a metabolic advantage. Muscle and bone by weight are the largest organ in the human body, and so it is the largest glucose disposal agent that we have. It makes us more sensitive to carbohydrates. It allows us to have more carbohydrates. It also helps with the natural insulin resistance that sort of creeps in as we age. It is the primary site for, God, I could nerd out on this all day, but it's like the primary site for fat utilization. This is another thing in perimenopause. Women will say, I'm literally doing the same thing that I was doing in my 20s and 30s, and now my lipid panel is abnormal. Like, now my total cholesterol is up, my LDL is up, my triglycerides are up. All of this lipid dysregulation begins to happen. That happens at the site, at the myocyte. And then the other thing I'll say is in perimenopause, many of us still have cycles, although it might be irregular. And every time you're training, every time you are resistance training specifically, you are giving yourself a natural endogenous, meaning made inside your own body, a natural endogenous boost of testosterone, main sex hormone in the female body. We love estradiol. We also love testosterone, right? So natural boost, somewhere between 10 and 72 hours, depending on how fit you are. It also promotes a healthy progesterone to estrogen balance in the second half of the cycle. So we won't get into the menstrual cycle now, but follicular, luteal is the second half of the cycle. Every time you're training, a healthy P to E, progesterone to estrogen balance. So that makes, it helps promote more progesterone relative to estrogen. So I'd say, like, wrapping that all up with a bow, every woman, it is absolutely necessary for your movement program, your exercise protocol, to include include resistance training. And if I may be so bold, it needs to be the absolute base. It has to be the foundation of your exercise. So you can get, if you're a newbie, you can get incredible results 2 times a week. And of course, you can gradient up from there, which we'll talk about, I'm sure, another time. Yeah.
Amazing. So, Cynthia, I think the audience would love to hear a little bit about the connection of gut health, women's health, immunity, and some of the work that you're doing. If you could share and shed some light.
Yeah, it's really interesting when you get into the research, which continues to emerge, especially as women are navigating perimenopause into menopause. We're really speaking to 10 years preceding menopause minimum. Average age of menopause here in the United States is 51, and helping women understand that estrogen, that we've been talking quite a bit about, has these protective effects. The gut microbiome is connected to the vaginal microbiome, which is connected to the oral microbiome and the skin microbiome. It's all connected. But understanding specifically what starts to shift and change around middle age is quite significant. Why do we see so many women developing autoimmune conditions in perimenopause and menopause? It's oftentimes a direct reflection of what is changing at the cellular level, understanding that the things we are exposed to and bombarded by every day, ultra-processed foods, chronic stress, a dose of antibiotics, which sometimes is completely appropriate, can disrupt that one cell layer thick in the small intestine, which then can make us susceptible to developing leaky gut, creating dysbiosis, all these non-beneficial things that can go on to create a cascade of issues that can impact us quite substantially. When I'm thinking about the gut microbiome, it's helping women understand the health of your gut microbiome impacts immune function. Dr. Gersh has done amazing work spreading information about the role of estrogen and immunity. It is like a lock and key mechanism. As we are losing estrogen, we are more likely to develop opportunistic infections, infections that do not belong. If the health of our gut microbiome is not optimal, we are less likely to have healthy bones. There is a brain-gut-bone connection. There is a brain-gut ovarian connection. Just about every system in the body is connected intricately to the brain and the gut. But I remind women, especially as we're seeing more and more osteopenia, osteoporosis, obviously one is more significant than the other, and I am part of a generation that was on oral contraceptives from our teenage years into our 30s, not realizing, because our very well-intentioned providers put us on oral contraceptives, I promise this is relevant, we missed out on the peak bone and muscle mass years. My entire generation, I was born in the 70s, I cannot tell you how many women we start looking at DEXA scans when we realize in their 40s and 50s they're already osteopenic. And that has a lot to do with this suppression of hormones, much like what happens as we are navigating perimenopause into menopause. So when we think about the gut microbiome, it's managing stress, it's getting good sleep, it's the consideration to hormone replacement therapy to be helpful for sealing up those tight junctions in the gut, and just being aware that we as women are at greater risk. We have a hyper-responsive immune response prior to going into menopause, but just by virtue of our gender, we are at greater risk for developing autoimmune conditions. And once you have one, you are more likely to have others. I speak from personal experience. However, the caveat being all of this is fixable. Obviously, Dr. Walls was able to, with a nutrient-dense diet, able to reverse her autoimmune condition, and so many of others of us have as well.
I'm going to ask a follow-up question on the gut health and the microbiome. So one of the things I think that we're just starting to scratch the surface on and understand is these molecules called postbiotics, right? Can you share a little bit about what those are, what we know about them, and just, you know, is it easy to just sort of fix our gut microbiome so we get these postbiotics?
I think that when I think about postbiotics, and probably many of you have heard about prebiotics and probiotics, and it's kind of in the same philosophy. Postbiotics are oftentimes things like urolithin A can be these signaling molecules in the gut. Polyphenols, we talk about brightly pigmented fruits and vegetables and how important and beneficial they are to the gut microbiome. One thing that I just want to segue into is saying there are many people that I work with who tell me they cannot tolerate much fiber from fruits, vegetables, etc. And that's oftentimes a reflection of what's going on in their own gut microbiome. But these postbiotic mechanisms can go in and be very beneficial for helping to render and improve upon the structural integrity that goes on. Along with postbiotics, we're talking about things like short-chain fatty acids, which I think for many people, they don't understand that they have a function as well as something that can be very beneficial for helping to heal and seal the gut. And so when I'm thinking about these signaling molecules like urolithin A is one example, it's really helping patients understand that they do have a role within the gut microbiome that can be of tremendous benefit. And most, if not all of my patients, emphasis on most, are just not able to get enough from their diet.
Can I just add something to that?
Absolutely.
So I love what everyone is saying, and I think it's so important to understand, like you were saying, there's a sequence of events when you eat food. It goes through stages of digestion and modification, and when you eat like miracle foods that are like, we talk about like broccoli is a star food and pomegranates are a star food, well, they don't just start out with the star. They have to turn into it. Now, they all have vitamins, minerals, fiber, but they have this magical stuff called polyphenols. And polyphenols have to then be modified, and the modification requires the optimal, correct gut microbiome. So like one you may know is soy. So soy has isoflavones, that's the polyphenol, but isoflavones in order to be functional, have to be converted to its metabolic byproduct equal. But many people don't have the right microbes to make that conversion. And you can eat a miracle food like pomegranates, but you don't have the right microbiome to convert its polyphenol, ellagic acid, into the miracle compound that does the actual work on a cellular level, the urolithin A. And there's so many things, like you said, that are conflicting with the development of healthy gut microbiome. And I always say, and don't forget the hormones, because every woman, when she transitions into menopause, and also when they're on oral contraceptives, have an altered negative, they call dysbiotic gut microbiome, and you're going to be less likely to make these critical conversions. So you can eat wonderful food, but you don't get quite the outcome as you could if you were able to convert it to the final product that has these amazing effects on a cellular level. So that's why sometimes while we're working on gut restoration, we need to take the product that's pre-made for us. Like when MTHFR, if you have the wrong genetics, you take methylated products, right, to help you. So I call it like recognize your handicap and then take care of it.
So to build on that, I think that's just an amazing point. And Dr. Walls, maybe you can connect a couple of points that have come up throughout this. So we've talked about urolithin A and postbiotics, and we've also mentioned the word mitophagy. So I was wondering if you could just share a little bit about what urolithin A is, what it does on the body.
So urolithin A is a compound that will support your mitochondria. Our mitochondria will age over time. And as we age over time, the mitochondria becomes smaller, it's less effective. What you want to be able to do is to help that mitochondria youthen. You would like to help it become smaller, that's fission, to be recycled into a more youthful, vital mitochondria. Urolithin A is a postbiotic that facilitates a process called mitophagy. And that mitophagy is a youthened mitochondria that is now far more effective at generating ATP. But in addition to generating ATP, it is more effective at sensing all of the activities that are happening within the cell. It is more effective at communicating with the nucleus. It is more effective at hormonal regulation as well. It is more effective at reducing that immune senescence. It will be more effective at reducing that progressive disability that is occurring in people with an autoimmune disease. It is more effective at improving longevity.
Thank you. So much of the research, at least the initial research on urolithin A, has been in the muscle space, which we know is critically important for longevity, and women have this sort of unique challenge. Dr. Stima, could you share a little bit just about what put urolithin A on your radar as a molecule? You know, you're working a lot with women in perimenopause, struggling with muscle. What sort of caught your eye and your attention?
I think for me, when I'm thinking about the perimenopausal woman and we're trying to develop a exercise protocol for her that's sustainable and doable for her over time, one of the big pieces of feedback that I tend to get from women is that they're not recovering in the same way. So it can be the same stimulus, maybe that they were doing 20 when they were 25, 35, and now 45 years of age. Her recovery has been attenuated, like it's harder for her to recover from the same stimulus, okay? So urolithin A in that way is helpful for recovery. I think it's also helpful as a, in terms of the myocyte, in terms of the muscle cell, it also upregulates muscle performance in the gym as well. So we've seen, and there's been really interesting studies at a dose of about 1% of urolithin A, where we're seeing an increase in endurance of the muscle. So it's either with endurance activity and also with resistance training activity, and then also peak performance. So, or I should say, strength. So when we're looking at strength, what the mechanism, and you and I actually talked about this on the show, it's like, what is the mechanism of action that's happening here? Is it that there's more, taking Urolithin A helps to increase motor unit recruitment? Is it that it's improving the number of motor units that are there? And it does seem to appear, at least from some of these studies that have been done, that it is the ability to recruit more of the motor unit in the muscle. So you're actually able to get a bigger contraction. You're able to facilitate activating more of the muscle itself, which of course over a longer delta is going to give you that muscle hypertrophy and strength gain that we're all looking for as women. And then I typically take mine after a workout because I know that it helps with recovery. I'm 47 now, and this is like, I don't recover in the same way that I did when I was 37 and 27, so I use it primarily after my workout to augment my recovery. But those are some of the studies and some of the literature that seems to be available right now for Urolithin A and its effect on performance in the gym and also as a recovery agent.
Amazing.
May I make a comment?
Of course.
So, I always bring the story back to hormones. It's just always hormones. So one of the things that I did early on when I heard about Urolithin A was what I always do when I hear about a new product or a new chemical or molecule, like what's its role with estrogen? And so I discovered in researching that Urolithin A is, drum roll, a phytoestrogen. So when women go through menopause, they develop muscle loss called sarcopenia. And many women, they say, I don't know what's wrong. I go to the gym, I work out, I try to build muscle, and it's not happening for me. My body composition is going the wrong direction, not the right direction. I'm losing muscle mass. I'm not putting on the muscle. That's because estradiol is critical for mitochondrial function, which is essential for muscle function and health. But no matter what, we're going to lose that hormone, and we lose it for menopause. Women don't have it right when they're on oral contraceptives. We live in a world of endocrine disruptors with lots of xenoestrogens. And so for a host of reasons, women have polycystic ovary syndrome. All these women have inadequate function of their mitochondria. They cannot make this vital muscle, and they don't have the recovery and all of that. So by recognizing that, like in menopause, we can't give hormones to be identical to a healthy 21-year-old. This is where I call it like amazingly wonderful. I mean, there's no other word but wonderful, to expand your therapeutic toolbox for women at every stage of life, and especially, of course, if they're on oral contraceptives, if they have PCOS or they're in menopause or transitioning, to add into their health regimen something as miraculous as Urolithin A that actually has so much data. And I'm very data driven. I mean, if it doesn't have any data, I'm not going to do it. So that has really excellent data, which I also researched, that shows efficacy. And so but the main thing is to understand the mechanism is through the mitochondria. And so at first it looks like, honestly, I say it looks like snake oil, because every time there's research, it's good for your brain. There's data on Alzheimer's. It's good for your muscles. It's good for pain, good for everything, because mitochondria are everywhere, doing everything to maintain health of the cell cycle. Like you talked about, the mitochondria are more than just energy, which is big enough of the deal. It does so much more, like you talked about. So I just was bowled over when I learned about this, and that's how we met. I was talking about this totally unrelated to this product. I'm saying Urolithin A is really special, and like so many of the special polyphenols that you use in supplements, it's a phytoestrogen, and I just have to give a call out for every phytoestrogen I meet.
So, Dr. Gersh, you're making my job so easy because you're so knowledgeable on this. One of the things, and I think this is like the question, right? We get there's like almost like how is it snake oil, because it works, to your point, on the mitochondria. And we actually, timeline, I think, Dr. Walls, you've had some conversations with our chief medical officer on a new clinical study, which is actually right now has been submitted for publication. So this is not published data, but it should be very soon, looking at immune aging and looking at immune health. And what this clinical trial found was that after 1 month of 1,000 milligram supplementation in healthy middle-aged adults, that pretty much every single immune marker was improved. So could you just shed, I know, like you said, you've had some conversations with Dr. Singh and how that plays a thought beyond just muscle health, how urolithin A could be something helpful for your, patient population.
So, I mean, this is really important for the autoimmune patient. As we age, over the age of 45, our immune cells are declining, and that will accelerate the autoimmune process. It will accelerate the accumulation of disability. So a really powerful youthening step is to restore the immune competency. That will slow the progression of disability. It will also reduce the risk of infection. It will reduce the risk of cancer. It will reduce the risk of brain atrophy. And again, this is one of the tremendous benefits of urolithin A, is slowing the immune senescence, that is, the aging of our immune cells.
So I think we have time for one more question. Cynthia, I'm going to actually sort of wrap up with you. And it's sort of a two-in-one. So number one, just if you could share if there's any concerns. I think we should always talk about safety concerns. But also, just with your experience in gut health, can we just get enough urolithin A from the diet for most people? I know Dr. Gersh kind of talked about the gut microbiome, but just sort of what your opinion as you're really diving into gut health and women and aging.
Yeah, I mean, I think by the time most women get to perimenopause and menopause, their guts have had such a tremendous insult, so they're not in an optimal state. In fact, I have never run a gut panel on a female patient that has not already had dysbiosis, which means non-beneficial overgrowth of bacteria in the gut, not one, in 9 years of working solely with women. When I think about urolithin A, or I think about can we get enough in our diet, I would never discourage one of my patients from eating a nutrient-dense, polyphenol-rich diet ever. However, I have yet to find a patient that has not benefited, and I say this both with a bit of trepidation because I have not been able to say that about any other supplement, maybe with the exception of creatine, but I have not yet found a patient that has not benefited, either from initially improvement in muscle strength, recovery, energy, but then also looking at gut health results over time and seeing the improvements that are there. I think for many women, it's hard to modulate stress. They may not be getting good sleep. They may not be eating a non-ultra processed diet all the time. So I look at this as an adjunct to all the other lifestyle pieces that I think are so critically important for women. And I also think the other piece that I would add to that is I'm very conscientious. I'm also very, if I would use the word anal retentive, about conservative. Thank you. Stephanie's like trying to find a better word for me. I'm very conservative about what I recommend. Anyone that listens to my podcast knows that. And I would agree with Dr. Gersh that you start looking at the research, and it takes a bit of research to feel comfortable to make recommendations and be able to make broad recommendations. And no, unfortunately, I don't think you can get enough in your diet. I just think with the way that our food is being produced, the quality of the soil or their lack thereof, we're just not getting the same nutrient profile. And you can eat all the pomegranates in the world, and it's not going to give you enough, unfortunately.
May I make one more?
Absolutely.
I wanted to just make a final comment. We were talking a little bit about this on the show, on the podcast when you came on. I think that my prediction for urolithin A is going to be very similar to the trajectory that was creatine, where creatine was very much, we thought it was just for the bros, and then it was like, oh no, it's good for muscle across genders, and now we know that there's brain benefits and immune benefits, and I think that we're going to see as there's more literature that we produce, that we look at, that urolithin A, to Dr. Gersh's point, it may seem like a little bit of snake oil, but it's because it affects it's multi-systematic. There's many systems that it positively benefits. And so I think what we'll see over the long term with more research and literature is that this is sort of like the new creatine, where we can really see it make positive impacts on many systems in the body.
Thank you for sharing, and thank you all of you for sharing your expertise with us in the audience. If anyone is interested in learning more about Urolithin A and MitoPure, our booth is right behind you at 8033. I'm happy to share any of the research that we have, and we'll also be offering a flash sale for those of you that are in attendance. So stop by and say hello, and I'm happy, as I said, to answer any questions that we didn't get a chance to address up here. Thank you, guys. Thank you so much.
Thank you.